Welcome. I'm glad that you're here. My name is Paige. I'm a nurse. I've been a nurse for 32 years, so a long time. Mostly worked in critical care, in emergency rooms, in intensive care units, and trauma units, and I flew with air ambulance. I did a little bit of addictions and mental health nursing, and now I help people navigate the healthcare system. So, and I help people like all the ways that people can fall through the cracks in the system. I try and help prevent that to the best of my ability. So that's what my videos are about. That's what these lives are about. For those of you who are new, I do these lives to help people navigate the system, to understand your rights, to feel more empowered as a patient. It's a safe space to ask questions and share your experiences. So just go ahead and put your comments, questions into the comment bar there, and I'll do my best to answer them and address them. And I've had some great participation in these lives where people are just sharing their hearts, sharing their concerns, their fears, their frustrating experiences that they've had. And tonight we're going to talk about some really important topics that I know a lot of you have asked about, either through the videos or on my TikTok channel. A lot of really great questions. So things like women's heart attack symptoms, that's a big one. How to get proper sleep and nutrition in the hospital, because as we all know, that is a tricky one. That's a tough one. It's kind of almost not heard of. And yet sleep and nutrition are both really important for healing, right? So, yeah, and then I also want to talk about what to do when we feel dismissed by our doctors and how to handle being labeled in your medical chart, whatever that label is. So, and as we go through these two, sorry, I just bumped the camera. Just trying to get myself comfortable here. As we go through these, I want to hear from you. So if you've ever experienced things that I'm talking about or you have questions, just put them in the comments. And if I happen to miss your comments or questions, just put it in again or stick your hand up virtually and say hello or whatever. So I just don't want you to feel alone. Your story can sometimes help someone else too. So that's really important. And share this live, with someone that you know is maybe struggling with the healthcare system, falling through the cracks in the healthcare system, and just share it and bring them into this conversation. Hi, Cassidy. Welcome. I just was introducing myself. I'll introduce myself again here quick, but my name is Paige. I'm a nurse. I've been a nurse for 32 years, and I help people navigate the healthcare system. I worked mostly in critical care, emergency rooms, trauma units, flew with air ambulance, and now I'm a patient advocate. So we are just on here talking about a few topics that I think are important, things that people have asked about, and and so we'll just dive into it. And if you guys have any comments, if you want to share experiences, Hype Thursday, please put them into the comments and we can talk about them. It's going to be pretty casual. I am going, because it's YouTube live, it will stay up on my channel. So I want to put some content in here that people can listen to later, but I also really want to hear from you guys. So the first thing I was going to talk about was women's heart health and how we've all seen, and women's heart attacks too. Hi, Mohammed. And if I say your names wrong, you guys, I apologize. I'll apologize up front. But we've all seen the movie version of a heart attack, right? Like the man, he's clutching his chest and he's got crushing pain. But for women, it often looks completely different. And this is a huge reason why women's heart attacks are so often missed or dismissed. There's kind of a classic heart attack, which men often present with, where it's like this chest pain and pressure, and they say it's like an elephant standing on your chest, pain radiating down your left arm, shortness of breath. For women, it can look like that, but more often it will look like, hi guys, hi Yoha, welcome, thanks for the like, for the heart. So for women's symptoms, it will often look different. And so things like unusual fatigue, this is a big one. So it's not just like, oh, I'm tired, but it's a profound, sudden exhaustion that makes it hard to even do simple tasks. So and shortness of breath, it can happen with or without pain, without chest pain. Pain in other areas. So this is common for women too with heart attacks. Hi, baby Behar. It was you. I'm not sure if you have have experienced these symptoms that I'm talking about with women. So we're talking about women's chest pain, or sorry, heart attack symptoms, how they look different from men. But women will often feel pain instead of like their classic left arm or elephant on the chest, they might feel pain in the jaw or neck or back, even stomach. It can sometimes feel like indigestion or reflux, nausea, dizziness, lightheadedness. So feeling sick to your stomach, like you're going to pass out, sweating, a cold, clammy sweat for no apparent reason. And the pain, so let's talk about the pain. So studies have shown that women's pain often is taken less seriously than men. So that was the heart attack symptoms look very different. So women, it gets missed, but pain in general, pain for women, it gets treated very differently than for men, unfortunately. And I'm not on here to trash talk doctors or the system or men or any of that kind of stuff. But the reality is it's still a patriarchal healthcare system. And so pain gets treated differently for women. And studies actually have shown that women's pain is often taken less seriously than men's. And women are more likely to be told it's stress or anxiety or it's in your head. Like a man will go into the ER with chest pain and he gets an EKG like immediately. A woman will come in with fatigue and back pain, and she might be told to take an antacid and go home and rest, or it's anxiety or whatever. So yeah, I don't know. So I'm just curious if anyone on here has experienced anything like that with either pain or kind of heart issues. So I had this, I've seen it happen so many times where like a woman just knew something was wrong. Hi, Tay Mason, welcome. She just knew something was wrong and was told like, well, your tests look normal. It was minimized, and she just kept having to push. Like women just have to push more to get heard sometimes. So, and obviously it's not straight across the board. And I know a lot of amazing doctors out there, and this isn't to trash talk our healthcare system. However, our healthcare system is overstretched and it's under-resourced and it's a struggle. So how to advocate for yourself when you kind of know something's wrong, you think it might be a heart attack, and it presents different than the movie scene of the dramatic, the man holding his chest. And I'm not minimizing men's heart attacks, but grabbing their chest and they collapse, right? Like we've seen it all in the movies. But when you go to the doctor, or the ER, don't just say like, oh, I don't feel well. Use the words like, I'm concerned I'm having a heart attack, or something like that. Be really, really specific. And it forces them, if you say, I'm concerned I'm having a heart attack, it will force them to rule it out. Like they just have no choice. It triggers a specific protocol in the hospital. So enlist your symptoms clearly. Like say I have sudden fatigue, jaw pain, I feel nauseous. Be really specific and don't let them dismiss you. If they say it's just anxiety, you can say, I understand you think it could be just anxiety, but what are we going to do to rule out a cardiac event? And you can even ask for specific tests, right? Like, are you planning on doing an EKG or checking my blood work? So you can be really specific and just kind of be really, really assertive. So anyway, I wanted to just speak on that because I've been asked about it a lot lately. And if you're just joining on here, my name is Paige. It is true. It's pretty crazy. My name is Paige. I'm a nurse. I've been a nurse for 32 years. I've worked in emergency rooms, intensive care units. I've flown with air ambulance. I've worked in a little bit for about 4 years. I worked in addictions nursing in a detox unit. I'm a patient advocate now, so I help people navigate the healthcare system. So we're just on here talking about all of the ways people can fall through the cracks in the healthcare system, and there's a lot of them, whether it's with your doctor or specialist or in the hospital or whatever. So let me just, I'm gonna try and read your comments because I didn't tell you my name earlier. Sorry. My name is Paige. And if you've watched my videos too, I have a TikTok channel as well, and then I post videos on here on YouTube, but you'll know what my real passions are. And I have a few things that I talk about frequently because they're really important. I just want to see Tay Mason's. Oh, thanks for the hearts and the likes. We don't true health. You can cup your hand and hit between elbow, and they say help with heart or blood circulation. Sorry, Tay Mason, I'm not catching that. So if you can, you be a little more clear? I want to. I think I kind of get what you're saying. I'm trying to read between the lines, but let me know. You can cup your hand and hit between the elbow. They say. Yeah, maybe just clarify that if you could, because I like hearing from you guys, and I like hearing questions, and I like comments or sharing experiences too. So, and I do have a few topics that I was going to talk about. They're just things that have come up lately. But if you guys have things that are on your heart to talk about, then go for it for sure. I was going to talk about getting sleep and nutrition in the hospital. So, I don't know, would you agree that both sleep and proper nutrition, like getting the right nutrients, are pertinent to healing, like our bodies and our minds? Actually, they need those two things to properly heal, and water too. And it's interesting to me, I worked in the hospital for 25 years, and those are two things that are just lacking. Like they're super critical, and yet the hospital is one of the worst places for both of them. It's just a huge systemic problem. Like it's just really not good. So why hospital sleep is so bad? Okay, Tay Mason, I'll come back to that in just 1 second. I'm just going to pause the scrolling there because I want to speak to that. Why hospital sleep is so bad? Well, for one, there's constant interruptions. Like you get your vital signs checked every 2 or 4 hours. They come along, give you medications. They come draw your blood. There's beeping machines, noisy roommates, bright lights. Like those fluorescent lights are on all the time, and they're really hyper stimulating. It's just impossible to get restorative sleep, like good sleep that we need for healing. And why the hospital food is so bad, like it's processed, and it's a money thing. I get it, and an efficiency thing. However, like the food is processed, most of it. It's bland, so it's often low quality. It's got high sodium. It's processed, so it has very little nutritional value, and it's designed to be cheap and easy to mass produce and not really promote healing, which is what a hospital's kind of supposed to be for. And then the timing that people are fed, like meals come at set times, whether you're hungry or not. If you're in a test, say you're down getting an x-ray, or you're trying to take a nap and sleep, like you might miss it completely. And then when you get it, it's cold. So I wanted to tell a little story here. So I remember a patient who was recovering from quite a major surgery. And every time I went in, she just was exhausted. She told me, I haven't slept more than an hour at a time in 3 days. And like, how can someone heal like that, right? Anyways, it can be really tough. And hearing that from her was like, oh, okay, I'm going to just let her sleep for a while. So there's a few things you can do. So for sleep, you can talk to your nurse and just say, hey, can we kind of bundle my care? Like try and do vital signs, medications, check my incision, whatever, all the things you got to do it all at once. And then that can give me a longer block of time to sleep, especially if it's at night. Like just kind of try and do that. You can put together a sleep kit, kind of like a lot of people don't know when they're going to be staying and sleeping in a hospital when they go in. But if you have a loved one that can pick these things up for you, like an eye mask, those things really help with the lights. Earplugs can really help. For me, I'm really sound sensitive, so it would drive me nuts hearing people at night snoring and screaming and talking, and I don't know. So I would need earplugs for sure. Maybe even your own pillow, if that makes it, like those little things can make a difference. You can also request a private room. Sometimes it's an option. Sometimes it can be costly though, but it does eliminate roommate noise. But there is a bed shortage too, so there might not be beds available for that. For nutrition, you can get your family to bring you food. For me, that's like the number one solution. If your diet allows, like if the hospital, you're not on a restricted diet, or you're not waiting for surgery, or a certain test doesn't say that you can't eat certain things, get your family to bring in like even smoothies or fresh fruit, some soup, really nutrient dense food that your body needs to heal. You can talk to a dietitian in the hospital too. Every hospital has registered dietitians that you can request a consult. They often work with the kitchen staff, and you can just ask for those things too, and sometimes it works. And keep some healthy snacks around too. So anyway, that's my little pitch on nutrition and sleep in a hospital. So go ahead, and if you want to comment about that. Okay, Tay Mason, hitting the inside of your forearm stops heart attacks. Oh, I don't know if did you see that in a movie? I have never heard of cupping your hand and hitting that part of your arm, your forearm, to stop heart attacks. I think that's maybe a movie thing, because I think that's maybe what you're saying, is that we see on TV or in the movies certain things about healthcare and our health that aren't accurate. I'm guessing that's maybe what you're saying, but correct me if I'm wrong. Blood is so creepy to me, baby bear. Yeah, well, it is creepy to a lot of people, for sure. Yeah, for sure it is. It's, for me, I mean, I worked in emergency rooms and trauma ICU and air ambulance. So for me, blood is not creepy, but you know what? We all have our things that we're good at and we're strong at. Like, there's so many professions out there that I couldn't do. I would be horrible at them. So it's a good thing we're all different. We have different interests and different skills. Like for me, if your heart stops, I'm the person you want there. Like, I'm calm. I know exactly what I need to do. I've done it hundreds of times, but if my email goes down, I lose my crap. Like, I feel like I want to throw my laptop out the window. So, but there's people in IT that I'm thankful for, and they can take care of that, because oh my goodness. Okay, so Tay Mason, summertime 4 hours it seems, winter 6 hours a night. Is that how much you sleep, like at home? I'm curious about that. Master Chief, do you smoke? No, I do not. Does Barbara O'Neill ring any bells? No, she does not. Hi, Dinah Major. Good to see you, and welcome on here. So no, okay, I'm not a teacher. Thank you, Merton. So yeah, what was I going to say? I'm not a teacher. So I'm a nurse, and I've been a nurse for 32 years, so a long time. And I've worked in critical care mostly, so emergency rooms and air ambulance. I took about 4 years and went and worked in a detox unit. So I did inner city addictions work, and I loved it. That was amazing. And now I'm a patient advocate, so I help people navigate the healthcare system. So all the pain points in our healthcare system that people struggle with, and there's a lot of them. It's kind of like anything from being, say, discharged too early from the hospital, or not without proper resources, or getting dismissed by your doctor, or not getting a proper diagnosis, like you're passed from specialist to specialist and you keep falling through the cracks, or maybe you're being dismissed by your doctor. Maybe you're not being believed. Maybe you're being told it's in your head. All of those kind of things. Like, there's so many different ways that people can fall through the cracks. So that's kind of what I do, and that's what this platform is about. It's just a place to talk about that stuff. Really, it's not to trash talk the healthcare system or doctors or anything. There's some amazing doctors out there, like absolutely amazing, who just really, really care about their patients. But it's like anything, right? Where there's humans involved, there's going to be some that are really, really good and some not so much. So they're not all equal, I guess, is my point. And unfortunately, in healthcare, that's where people are at their most vulnerable often. And there's just no room for that. Like, that should not happen in healthcare, in my opinion. So, I'm just going to scroll here. I want to make sure I don't miss anything. Merton, your name is Tim. Okay. Yeah, it's really hard to tell with some names on here. I just kind of go by what I see on there. So thank you thank you, Velvet. I'm calling you Velvet. I picked the easiest word, FLM, Velvet. Thank you. Yeah, thank you so much. Okay. That's dime. I just want to make sure Dima major. That's bad. Yeah. So anyways, if you guys do have questions about what I'm talking about, or you want to share experiences about something you've gone through in the healthcare system or someone you know, then just put it in the comments, and I'm going to do my best every once in a while to check in on that. I wanted to tell you about my book too. This isn't a pitch for my book, but a few people have asked me to kind of just share a little bit. So I am an author. And this channel was supposed to be originally for my books. That's why it's called Paige Lennox Books and Patient Advocacy. And then it kind of morphed into, I wrote this healthcare book. It's a guidebook on how to navigate the healthcare system. And then things just kind of morphed into more on the patient advocate side and the healthcare side. So anyway, here's the book. And it's a guidebook, so it's not one that you read like from start to finish. But I'm really nerdy, so it's got all of these color codes. So then you pick whatever topic, and it's everything from mental health, knowing your patient rights. What else is in here? Understanding tests and specialist referrals, impact of systemic racism, newcomers, so where English is a second language, LGBTQ, remote care, seniors, end of life stuff, caregivers. There's a chapter for caregivers. Anyways, and so then it's all color coded, and there's tons of resources in here. There's places to put notes. So it's a guidebook, but anyway, it's on Amazon. The link I think is in my bio, but it's in the description on all my videos too. So anyways, if you're interested in it, a lot of people have been buying them for Christmas presents. I'm like, okay, I guess that's, I mean, I've written some children's books too, so I would think that those would be better for Christmas presents. But people like being able to advocate for yourself in our healthcare system, it's not really a luxury anymore. It's kind of more of a necessity, and I think people are just realizing that. And so that's my goal, is to just educate people, really. It's not to, I've had a few people say, oh, you're freaking me out, Paige, but by the stuff you're talking about. But it's not to freak people out. I just feel like these things happen. These things that I talk about, they happen. I've seen them. And I think just being kind of tucking it away in the back of your mind and then you're a bit more prepared and having that knowledge, right? That knowledge to kind of what to watch for as you're going through the healthcare system, whether that's, something acute that's happening now to you physically, or something chronic, like a chronic illness. So anyway, hi guys. Oh, Mac's on here. Excellent. So we kind of talked about women's heart attack symptoms and how that can look different. We've talked about women in pain and how that can look different and present differently for men. We talked about, the joys of not getting sleep or good nutrition in the hospital, when really those are things that are really super important for healing. And now we're just going to talk about if you're feeling like you're not being heard by your doctor, or you're feeling dismissed, or they're not believing you. And this happens a lot with young people and also older people. And that's called ageism, where young people will come in and maybe they look okay, but inside they've got, I call them an invisible illness. So they might have a chronic illness, they might have pain, they might different things going on, but they look okay because they're younger, they might look healthier. And I can't tell you how many times I've heard the doctor say, well, you're too young to be sick, or you're too young to have that test or whatever. And then on the other end, with older people, it's almost like once you hit like 65 or 70, you just don't matter anymore. And the doctors will just say, well, it's because of age, and that's just to be expected. And they'll stop ordering investigative tests or diagnostics. They won't recommend surgeries. So anyways, that can absolutely happen, but it can happen everywhere in between too. And it's a terrible feeling. Like you're in the doctor's office, you're scared, you're vulnerable, and the person who's supposed to help you is like looking at their watch too. That's another thing that can happen. Or they're sitting there typing on their computer and their back is turned to you, and you can't, And if they have an accent of any kind, good luck trying to understand them. So they kind of, or they'll just like roll their eyes sometimes. And I've seen all of this, you guys. And like I said, I'm not on here trash talking doctors or the healthcare system. There's some awesome doctors out there. Awesome. Then they just love their patients. But unfortunately, I've seen some of these things that I talk about in my videos. And so it's not to freak people out. It's not to be negative. It's just to be aware that these things can happen. And then when you kind of have that knowledge and that understanding of what to watch for, you're a bit more prepared. And if it does happen, you've at least got some tools, or you might remember, oh, I heard that thing. So anyways, it's tough. And I don't know, I mean, the part about doctors dismissing or being dismissive, why does that happen? I'm not really sure. I mean, I think it's time pressure sometimes. So doctors are often given only 15 minutes per patient, so they're rushed, and maybe they're overbooked, maybe they're burnt out. The system's really hard on healthcare workers, especially since the pandemic. Everybody got burned out. And after that, a lot of doctors moved away, they quit, they decided to scale back on their practice. So there's a doctor shortage right now, and there's a less, what's the word I'm looking for? There's fewer doctors graduating from medical school right now than, I can't say ever, but for a long time. And same with nurses too. So there's a shortage, so they're trying to cram in too many appointments in a day. I think the other thing that can happen is there's bias sometimes, right? So, and maybe it's unconscious for them, but women, there's bias towards women, there's bias towards age, people of color can be biased, socioeconomic status, and people with chronic pain or chronic illnesses that are complex, there's bias towards that too. So I think there's probably always bias, but I just want to make sure I'm not missing any of your comments. I just realized, because there's not too many people in here, that it's Thanksgiving week, so I think that's maybe why it's a bit more quiet. Tay Mason, as they do happen, we took mate out of mental illness back home. All good. I'm not really sure what you mean by that, but if you want to clarify it, we can talk about mental health stuff for sure. Hi, Miriam. And if you're just joining on here, my name is Paige. I'm a nurse. I've been a nurse for 32 years, so a long time. I worked mostly in emergency rooms, in trauma, ICU, and I flew with air ambulance. And I worked a little bit in addictions nursing and a few other spots. Kind of, I did little sabbaticals here and there, but that's mostly where I worked. Now I'm a patient advocate, so I help people navigate the healthcare system and all of the ways that people can fall through the cracks. And we all know, probably everyone, at least for either for themselves or someone they know, has experienced the stuff that I'm talking about. But I try and help people avoid that if possible. And there's a lot of pain points in our system too. So anyways, I'm trying to just catch these, but thanks, Miriam. I think you've been on here before. So I don't know if you guys have any questions. The other thing I was going to talk about, because this has come up a lot lately, is what to do, kind of along the lines of what I was just talking about, but what to do if you have been labeled. So if you, and I'll kind of explain what I mean by that, but if you have gone in and maybe you start getting frustrated because you feel like you're not being understood by your doctor, maybe they're not believing you that you've got the symptoms that you do, or pain or whatever. There's a lot of ways that you can get labeled. It can also be if you're a caregiver for somebody and you see them not being treated well or properly or respectfully, and you start to escalate and you start to get frustrated, and you can be labeled as a difficult patient. People that have chronic pain that are trying to manage and navigate their pain, they can sometimes be labeled as drug seeking. You can, if you're someone that experiences white coat syndrome, where you go into the doctor's office and you just freeze and you totally forget what you were gonna ask, you can be labeled as an anxious patient. So you can get these labels put on you, and the crappy thing is that they will often get written in your charts, and then they follow you. So then next thing you know, you're going into the emergency room for something, and oftentimes these labels will just pop up on your chart, and that's what they see first, and they sometimes can't see beyond that, and all of a sudden this bias is in place, right? So a doctor writes in your chart these things, and then it's really hard to get rid of. And often the other staff will just kind of see that. So like a new doctor that you see, like, okay, say you go to a specialist. Now your family doctor has all of your documentation. They're the ones that write the referral letter to the specialist, and that label is going to go with your chart. So anyways, so yeah, those doctors will see that. Police record, it seems. Hospital labels. Oh, police record. So if you have like a criminal record or something, it'll end up in your hospital records. I'm not sure what you mean by that, Tay Mason. I'm really trying hard to read between the lines with your comments. I'm trying really hard. You're probably just typing fast. And a lot of people on here do. They just type really fast, and then it takes me, I think it's a certain skill to be able to read those. I'm just going to give you a second to see if you can elaborate on that. Okay, well, anyway, I'm just going to continue, but if you decide to expand on that, I'm just going to stay on here for another few minutes, you guys, because there's not too many of us, and but I love that you guys are here, so thank you. And it's, this is a really sensitive topic, this thing about labels, but it's really, really important too. So, like, I don't know, has anyone ever felt like a past diagnosis or label on your chart has affected your care? And it can, like, I've heard of a lot of people that have asked that question. So how do you address it? I'm just going to get into that. You can get your records. So you get your records, have a look at them. They're your property. You have the right to see your medical records. So get a copy and see what's actually written there. And with a new doctor that you're seeing, maybe it's a specialist, maybe it's a doctor in the ER, just address it head on. Like, say, I know my previous records mention anxiety, and while I have experienced that, I'm here today for something totally different. It's a physical symptom, and like, can we just skip that whole thing? Like, you can just address it right, and then focus on the present. Keep bringing the conversation back to your current symptoms. You can also ask your doctor, whoever wrote it. You can write, I've been labeled a genius. It's embarrassing. That's rough, Mac. That's really rough. Hospital records like police records. Oh, hospital records like police records. So hospitals, I haven't heard of that actually. I mean, definitely when I worked in the ER, if the police brought somebody in, there would be a note in in our documentation, in our charting from the police. So there'd be like a police little write-up there. So I'm not sure if that's kind of what you mean. Anyways, you can ask whatever doctor wrote the label in your chart, you can ask them to remove it. But I mean, it's all how you present it. So if you go in freaking out on them, they're not going to remove it because you're kind of just validating what they've written about you. But if you share your heart, say like, I'm concerned about this. I don't feel that that's accurate. I feel like it's affecting my care with other doctors. Can you please remove it? A lot of times they will. Or because it's a legal document, sometimes what they'll do is they'll write a letter that kind of counters whatever that label is. So KQ4949, I love some of these names. When will we see change in the healthcare system? Oh, that's a very good question. It looks like you're in Canada. That's a very good question. I don't have an answer. I wish I did. I wish there was, it comes from the top, right? So it's a high level change, and healthcare, it takes a long time to change. And I think, I understand why, because of HIPAA and all the privacy and confidentiality, and it's people's health and their vulnerabilities. But yeah, it takes a long time. And technology's coming in, right? Like AI and all the forms of technology, and that's going to have a big impact on our system too. But it's an interesting balance because tech moves so fast and healthcare moves so slow. So, and Canada is probably, I don't think I'm exaggerating when I say about 10 years behind most other countries in the world. Canada is way behind. Especially, there's some countries that are way further ahead. So it is discouraging. for sure. And I'm not sure, something's going to have to change because everything's bulging at the seams right now. It's under-resourced, it's overstretched, and there's a shortage of doctors too. So, and the wait times and all of that. And people, I have a lot of people from the States that usually come on here. And they all say, of course, well, you guys have the best healthcare because it's free. Yeah, it's free, but it's also very basic. And about 1/3, well, maybe not 1/3, I think it's like 30% is now private, something like that ish. I'm not quoting a direct stat, but it's getting up there. So, and also in my, like with my advocates, we're starting to send people down to the States more too. What's your book all about and who should read it? Oh, good question, Matt. So I introduced my book, or I was showing my book before you came on a couple of times, but I will show it again. And I was also telling them that, so this channel was supposed to be just about my books. That's why it says Paige Lennox Books and Patient Advocacy. And then once this book came out, then I started getting questions about this. And anyways, now it's morphed into more of the healthcare stuff, but I'll show you. That's the front. That's the back. It's called Unlocking Canadian Healthcare. It's basically a guidebook on how to navigate the healthcare system. It's not a book you read start to finish. It's a guidebook. So it's a how-to kind of thing. And I'm really nerdy, so it's all color-coded. So you basically just go to whatever you're looking for. So there's everything from patient rights, how to speak up, mental health, English as a second language, caregivers, LGBTQ. Anyway, there's quite a few things. And then this is my favorite part, is you just find the color, and then it's all like color coded. And there's lots of resources in here. There's places to write notes and whatever. So anyway, it's on Amazon. The link's in my descriptions on my videos. And I think it's in the bio too. So thanks for asking. Oh, you're colorblind. Well, you know what, Mac? You're going to have to just read. Like, go old school and just read. Yeah, it's actually got, look at how big the font is. It's like really big font. So I think you can handle that. Anyways, okay, well, you guys are awesome. Thanks for hopping on here. I'll come back next Tuesday at the same time at 5:30 Pacific time. And yeah, so until then, I'm going to say adios, and we'll talk to you later.